You walk every day. Maybe you circle the neighborhood before breakfast. Maybe you count every step on your phone. Maybe you have been told, again and again, that walking is the best thing you can do after 60. But something does not add up. The walk is still there. The strength is not. You notice it when the chair is low. You notice it halfway up the stairs. You notice it when one grocery bag suddenly feels heavier than it should. And perhaps the most frustrating part is this. You are doing what you were told to do. So why do your legs still feel weak? And here is the answer in one sentence. Walking trains your body to keep walking. But strong, reliable legs also need resistance, balance, faster force, adequate recovery, and, sometimes, a medical evaluation. In this video, we will separate 7 different reasons that walking may not be enough. By the end, you will know which gap may apply to you, what you can add safely, and which warning signs mean that more exercise is not the right first step. And stay with me for the final reason, because it changes the plan completely. Sometimes weak legs are not asking for a harder workout. They are asking you to investigate the cause. Before we begin, try one simple observation. Use a firm chair that does not roll. Place it against a wall. Keep a stable counter, sturdy support, or another person nearby if your balance is uncertain. Sit normally, with both feet on the floor. Now think about the last time you stood up. Did you press hard through both hands? Did you rock forward more than once? Did one leg seem to do most of the work? Did you rise, but feel as if you had almost no strength left in reserve? This is not a diagnosis, and it is not a pass or fail test. It is a clue. Walking can hide weakness, because each step may ask for only a small portion of the force your legs can produce. A low chair, a staircase, or a sudden loss of balance can ask for much more. That difference is where our first reason begins. Reason number 1. Your legs may not be receiving enough resistance. A daily walk can be wonderful for your heart, lungs, mood, circulation, and general mobility. But walking on level ground usually asks your muscles to repeat a familiar movement against a familiar load. Your body is very good at becoming efficient. The route that felt challenging during your first week may feel almost automatic a few months later. That is not failure, it is adaptation. But adaptation creates a problem. Once your body has mastered the demand, repeating exactly the same demand may maintain the skill, without giving your muscles a strong reason to become more capable. Strength training works differently. A muscle becomes stronger when it is gradually asked to handle a little more than it has already mastered. That extra challenge does not need to be dramatic. It might mean one additional controlled repetition, a slightly firmer resistance band, less assistance from your hands, or a slower lowering phase when you sit down. The key word is gradual, not heavier and heavier at any cost, not pushing through pain. Just enough progression to prevent the exercise from becoming completely effortless. Here is a practical way to feel the difference. Walking moves your body forward. A sit to stand asks your thighs and hips to lift your body upward against gravity. Those are not the same demand. Try this only if it is safe for you. Use that firm chair against a wall. Bring your feet slightly back, lean your chest forward, and use as much help from your hands as you need. Stand with control, then lower yourself slowly instead of dropping into the seat. The slow lowering phase is important because your muscles must control your weight. Begin with a small number of clean repetitions. Stop before your form breaks down. When that number feels easy across several sessions, change only one thing. Add one repetition. Use slightly less hand pressure, or increase the resistance under professional guidance. So the first gap is resistance, not distance. Walking may help you keep walking. Resistance work helps prepare your legs for the moments when walking is not the task. And that leads to reason number 2. because even a person with decent strength can struggle when the movement demands a larger range. Reason number 2. Level walking does not prepare your legs equally for chairs, stairs, and the floor. Watch how small an ordinary step can be. Your knee bends, your hip moves, your foot clears the ground. Then you repeat. Now compare that with rising from a low sofa. Your hips begin lower. Your knees must straighten against more resistance. Your trunk must move into the right position. Your feet must stay stable while your body changes direction from sitting to standing. A staircase asks something different again. One leg must lift much of your body upward while the other prepares for the next step. This explains a common mystery. Someone can walk for 30 minutes and still avoid low chairs. They can walk around a store but pause before a staircase. They can complete thousands of steps, yet need both arms to rise from the toilet or sofa. That person may have walking endurance. What they may lack is strength, through the range required by harder daily movements. Think of this as strength reserve. If standing from a chair requires almost everything your legs can produce, you may still complete it. But there is little left when the chair is lower, when you are tired, when you are carrying something, or when the floor is slippery. The goal is not simply to complete the movement. The goal is to complete it with enough reserve that ordinary life does not feel like a maximum effort test. You can train this reserve with movements that resemble real life. A supported sit-to-stand is one example. A supported step up onto a very low, stable step may be another, but only when it is appropriate for your joints and balance, and preferably after guidance if stairs already feel unsafe. Supported heel raises can help your calves contribute to standing and walking. Stand at a stable counter, keep your body upright, lift both heels slowly, and lower them with control. None of these needs to look impressive. Useful exercise after 60 is not about performing for a camera. It is about making a chair, a curb, and a staircase ask for a smaller percentage of what your body can do. So the second gap is range and task specificity. Walking practices walking. Daily life asks for more than walking. Now here is where the story changes again. Strength tells us how much force you can produce, but a stumble may give you less than a second to use it. Reason number 3. Endurance is not the same as power. Imagine that your toe catches the edge of a rug. There is no time for a slow, carefully planned movement. Your body must lift the foot, move the leg, place it in a safer position, and control your weight quickly enough to prevent a fall. That is where muscle power matters. Power is not the same as jumping, sprinting, or doing dangerous explosive exercise. It simply describes how quickly your muscles can produce useful force. This quality can fade quietly, because daily life gives us many ways to avoid using it. We choose the higher chair. We push harder with our arms. We take the elevator. We move more slowly and call it caution. Sometimes those choices are sensible, but over time, the legs receive fewer opportunities to rise with purpose or respond to a sudden change. A safe beginner version of power training can be very simple. Return to the firm chair. Use your hands as needed. Stand with controlled intention. Do not rush. Do not throw your body forward. Just begin the upward movement decisively. Then sit down slowly. Rise with intention. Lower with control. That difference matters. Fast and reckless are not the same thing. You are not competing with a timer. You are teaching your body to produce force when you ask for it, while keeping the movement stable. If you have significant weakness, osteoporosis with movement restrictions, major joint pain, a recent fall, a recent operation, or uncertainty about whether this is appropriate, a physical therapist can help you choose a safer starting point. So the third gap is the speed of useful force. You may have enough endurance to walk around the block, but not enough quick reserve to recover from a misstep. Now we need to separate two ideas that are often mixed together. Resistance challenges muscle strength. Walking intensity challenges the heart, lungs, and endurance system. That brings us to reason number 4. Reason number 4. Your walk may be too comfortable to improve your fitness. Two people can both walk for 30 minutes and send very different signals to the body. One moves at a relaxed pace that barely changes their breathing. The other includes short periods of purposeful walking that make breathing more noticeable while still allowing conversation. Both walks count as movement. Both can be enjoyable, but they are not the same training stimulus. Public health guidance for older adults recommends a combination of aerobic activity, muscle strengthening activity, and balance activity. For aerobic activity, moderate intensity is often described as breathing harder while still being able to talk. Your own level matters. A pace that feels easy to one person may be challenging to another. Medications, heart and lung conditions, joint problems, heat, terrain, and current fitness can all change what is appropriate. For someone who is medically able to increase intensity, the answer may not be walking much farther. It may be adding contrast. Begin easily. Walk at a more purposeful pace for a short period, then return to an easier pace. The goal is not gasping, it is not exhaustion. It is simply giving the cardiovascular system a reason to adapt. But this is where an important safety distinction appears. Do not assume that every uncomfortable leg needs to be pushed harder. If aching, heaviness, cramping, weakness, or numbness appears predictably when you walk or climb stairs and improves when you rest, speak with a healthcare professional. That pattern can have several causes, including peripheral artery disease, which affects blood flow to the limbs. Likewise, if increasing speed makes you noticeably less stable, improve control before chasing pace. Ask yourself a better question. Am I under-challenged? Or is my body warning me? Those are not the same situation. So the fourth gap is aerobic intensity, not muscular resistance. And now we reach a part of movement that a straight walk barely tests. Reason number 5. Walking forward does not fully train balance. Most walks happen in one direction. Real life does not. You turn in a narrow kitchen. You step sideways around a chair. You reach into a cupboard. You move around another person. You step over a threshold. You change direction in a bathroom where the floor may be wet. Each of these actions asks your body to manage weight in a different position. Balance is not one muscle. It is a conversation among your eyes, inner ears, brain, joints, muscles, and the sensory information coming from your feet. That is why someone can walk a reasonable distance and still feel uncertain when turning. It is also why stronger thighs do not automatically solve every balance problem. If the brain is receiving less accurate information from the feet, the map of the ground becomes less reliable. Peripheral neuropathy can cause tingling, burning, numbness, muscle weakness, or a reduced sense of where the foot is positioned. When position sense is affected, coordinating walking and maintaining balance can become harder. This does not mean every tingling foot is neuropathy. It means persistent sensory changes deserve evaluation, especially when they affect walking or balance. Balance practice should look controlled, not dramatic. Stand beside a stable counter. Keep your fingertips available. Shift your weight gently from one foot to the other. Return to the middle each time. Or practice slow, supported marching, lifting one foot only as high as you can control. Another option is a staggered stance, with one foot slightly ahead of the other, while keeping support close. The counter is not cheating. The goal is to challenge your balance system without creating a realistic chance of falling. Do not close your eyes as a default progression. Vision is an important part of balance. and removing it can make the exercise much harder, especially when sensation in the feet is reduced. If dizziness, repeated falls, or sudden balance changes are present, get assessed rather than trying to solve the problem with random internet exercises. So the fifth gap is control in more than one direction. Your walk may train forward motion. Independence requires turning, shifting, reaching, stepping, and recovering. Now let us address the reason that creates some of the most misleading videos in this niche. Reason number 6. Your body may not have enough support to respond to the training. Exercise gives the body a signal. Nutrition and recovery help determine how well the body can respond. If someone is eating very little, regularly skipping meals, losing weight without trying, or getting very little protein across the day, adding more activity may not correct the underlying shortage. But this is where we need to be precise. There is no single food that forces old muscles to grow. No breakfast rebuilds weak legs by itself. No powder replaces progressive resistance training. Enough total food, adequate sleep, and medical care when needed. Protein matters because it provides amino acids used in muscle maintenance and repair. But the right amount is not identical for every person. Body size, activity, appetite, total diet, kidney function, and other health conditions all matter. Instead of chasing one miracle number, examine your pattern. Does breakfast contain a meaningful protein source? What about lunch? What about dinner? Or does almost all of your protein arrive in one meal late in the day? Common options can include eggs, yogurt, fish, poultry, tofu, beans, lentils, and other foods that fit your needs and preferences. If you have kidney disease, diabetes, poor appetite, swallowing problems, or unintentional weight loss, a registered dietitian or healthcare professional can help personalize the plan. Recovery also includes the rest of the day. A 30-minute walk is valuable, but it does not erase many hours of almost complete inactivity. If you spend long periods seated, build small movement reminders into routines you already have. Stand up once or twice before a meal, using support as needed. Perform a few supported heel raises at the kitchen counter. Walk briefly after a long television program. These small movements are not a substitute for structured training. They simply reduce the long gaps during which the legs are asked to do almost nothing. Sleep matters too. Pain matters. Illness matters. If every session leaves you depleted rather than gradually more capable, the plan may need less volume, more recovery, or professional guidance. So the sixth gap is support. Muscles need an appropriate challenge, but they also need enough nutrition, recovery, and repeated opportunities to move. Now we arrive at the final reason. This is the one that prevents an exercise video from becoming dangerous. Reason number 7. The weakness may not be a fitness problem. Not every weak leg needs another set of chair stands. Sometimes weakness is a symptom. The pattern tells us where to look next. Did the weakness develop gradually in both legs? Did it begin suddenly? Is one side clearly different from the other? Is there pain, numbness, burning, or tingling? Does walking trigger calf pain or heaviness that improves with rest? Did the change begin after an illness? Did it appear after a new medication or dose change? Is one foot colder, paler, or a different color? Is there a wound on a foot or leg that is healing slowly? Those details matter more than the number of steps on your watch. Persistent weakness can have many possible causes. Age-related loss of muscle strength is one possibility. Others include nerve problems, circulation problems, joint or spine conditions, anemia, thyroid disorders, illness, inactivity, nutritional problems, and medication effects. A video cannot tell you which one applies. That requires your history, an examination, and sometimes testing. Contact a healthcare professional when weakness persists, progresses, repeatedly interferes with daily activities, or has no clear explanation. Do not stop a prescribed medication on your own, and some symptoms need urgent action. Sudden weakness, especially on one side of the body, is not something to test with another walk. Facial drooping, arm weakness, unusual speech, sudden difficulty walking, or sudden loss of coordination can be signs of a stroke. Call emergency services immediately. Seek urgent help as well for severe chest pain, major breathing difficulty, or a sudden inability to move part of the body. This is not included to frighten you. It is included because the safest exercise plan begins by separating a training gap from a medical warning sign. Now, we can solve the contradiction from the beginning. Walking is not failing you. It may simply be doing one job while several other jobs remain uncovered. Think of your week as three main signals. The first signal is endurance. Keep walking if walking is safe and appropriate for you. Begin at a comfortable pace. Add time, incline, or short purposeful intervals gradually. Change one variable at a time rather than increasing everything at once. The second signal is strength. Include muscle strengthening activity on at least 2 days of the week, when appropriate for your health and abilities. A simple lower body session might include supported sit-to-stands, supported heel raises, and supported side leg movements. The exact repetitions are less important than clean control and gradual progression. Choose a number you can perform safely. Rest. Notice how your body responds. When the movement becomes clearly easier, make one small progression. The third signal is balance. Practice supported weight shifts, slow marching, a staggered stance, or careful turns in an uncluttered space. Keep a counter, wall, sturdy chair, or trained helper nearby. The best balance exercise is not the one that looks hardest. It is the one that challenges you slightly, without making a fall likely. Before each session, use a simple traffic light check. Green means your symptoms are familiar, your body feels stable, and the movement is controlled. Continue at an appropriate level. Yellow means unusual fatigue, increased joint pain, new tingling or numbness, or noticeably poorer balance. Reduce the challenge, and seek advice if the change persists. Red means sudden weakness, one-sided symptoms, chest pain, severe dizziness, major shortness of breath, or a new inability to control part of the body. Stop and seek urgent medical help. That 30-second check is more useful than blindly obeying yesterday's step target. So let us bring all 7 reasons together. Your legs can remain weak, even when you walk every day, because the same route may no longer provide enough challenge, because level walking does not prepare every muscle for low chairs and stairs, because endurance is not the same as producing force quickly, because your pace may be too comfortable to improve aerobic fitness, because forward walking does not fully train turning, shifting, and balance, because your training may not be supported by enough nutrition, recovery, and movement throughout the day, or because the weakness is a symptom that needs medical evaluation. The answer is usually not to abandon walking. It is to stop asking walking to do every job. Walk for endurance. Use appropriate resistance for strength. Practice control for balance. Support the work with nutrition and recovery. And investigate symptoms that do not fit a simple exercise problem. Now return to the chair observation from the beginning. Using your hands was only the first clue. 2 people can both stand from the same chair and reveal very different levels of mobility. The difference may be in the position of their feet, how much they lean, whether one leg takes over, how controlled the descent looks, and how much strength appears to remain after the movement is complete. In the next video, we will break down the chair rise assessment safely, including the mistake that can make the result misleading. Because the most important question is not simply, can you stand? It is this: how much reserve do your legs have left after you do? Subscribe to Root Cause Health for clear, research-based guidance about staying strong, mobile, and independent after 60. Keep walking. Just make sure your legs are receiving the other signals they need.